This is Takoa Rogers, FNP student for Albany State University, recording a dictation note for Dr. Brand. Patient AG, age 46, male, date of encounter is 2/28/2020. Patient states, I cut my hand. HPI. This is a 46-year-old male presenting with a 3 centimeter laceration to his left ring finger. He states that he was at work and his hand got caught in a chain, and as the chain pulled, it cut his finger open. He rates the pain as a 7 on a 0 to 10 scale, with 10 being the worst. He denies any surgical history, denies any medical history, denies any allergies, and denies taking any current medications. His immunizations, he is unsure, but states that he has not had a tetanus shot he knows in the past 5 to 10 years. He denies smoking, denies any alcohol or substance abuse. Family history. The patient lives at home alone. He has no children and does not have a spouse. And medical history for his parents. His mother has hypertension and his father also has hypertension as well. And they are both treated with PO medications for that. Review of systems. He denies any additional symptoms, and he only has the 3 centimeter laceration to his left ring finger that he is seeking treatment for on today. HEENT. He denies any cough or sneezing, denies any congestion, he denies any itchy or watery eyes, and he denies having any headaches or vision problems at this time. Respiratory, he denies shortness of breath and denies any cough or wheezing. Cardiovascular, he denies palpitations, denies any chest pain or syncope or heart murmurs. GI, he denies any loss of appetite, denies nausea, vomiting, and also denies any bowel habits. GU, he denies any dysuria, burning, or pain. Musculoskeletal, he denies any cramps or muscle weakness. For skin, he has a 3 centimeter laceration to the left ring finger. The edges of the laceration are approximated, and the bleeding has been controlled with gauze and pressure. Endo, he denies any polydipsia or polyuria, and he denies any temperature intolerances as well. Hematologic, he denies any anemia, denies any excessive bruising or any varicose veins, denies any pain or swelling to his lymph nodes. Neuro, he denies any convulsions or epilepsy, and for psych, he denies any feelings of depression or suicidal thoughts. Objective data. His blood pressure is 139/90, heart rate is 69, temperature is 97.8, his respiratory rate is 18, oxygen saturation is 100% on room air. This is a 200-pound male who is 72 inches tall and has a BMI of 27.1. General data. He is alert and well nourished and well groomed, and he's appropriately dressed. He's also friendly and cooperative during this visit. HEENT. His head is normocephalic, his eyes are symmetric in size and shape and color as well as position. The conjunctiva is clear and he has no drainage from his eyes or ears. His neck is supple with no pain or deformities noted. Cardiovascular, his S1 and S2 are heard with auscultation. His pulse rate is regular with a rate of 69 with no murmurs, gallops, or rubs. Respiratory, on auscultation, the lung sounds are clear bilaterally. The chest is symmetric with an even rise and fall. Respiratory movements are non-labored at 18 per minute. GI, his abdomen is soft and non-tender. He has no lumps noted there. No hums or bruits are noted as well. For GU, his bladder is non-distended and non-tender. Musculoskeletal, he has full range of motion of his extremities. No crepitations on joint movements are noted, and he has no edema. For skin, again, he has a 3 centimeter laceration to the left finger. The bleeding is controlled at this time. The edges of the laceration are approximated, and there is some subcutaneous tissue exposure. For psych, he answers questions appropriately and denies any suicidal, homicidal thoughts or ideations. For lab work, we did a urine drug screen for a workman's comp. Due to this issue happening on the job, the patient supervisor came in and provided paperwork and information for that to the lab, but that urine drug screen was ordered. We also did a x-ray. We did a x-ray of the left hand with 3 views, and this x-ray did provide that there was no deep tissue injury. For his diagnosis on today for assessment, he has a laceration to the left finger. For treatment plan, we did a digital block with 1% lidocaine with injections to the base of that left ring finger, allowed that to numb the area. We gave it 5 to 10 minutes to numb the area. We went in and did a suture repair with 4O ethanol sutures. We did interrupted sutures times 12 to the area, and he also received a tetanus immunization. He was given instructions to keep the area clean and dry and to follow up with his primary care provider in 7 to 10 days for suture removal. Patient tolerated the procedure well. The wound was then dressed with a Telfa nonstick dressing, which was applied to that finger, and it was wrapped with gauze and secured with tape. And the patient received all discharge instructions and noted that he would follow up with the PCP in 7 to 10 days. Thank you.